Insomnia is a common sleep disorder characterized by difficulty falling asleep that can last for days or weeks, known as short-term insomnia, or for more than 6 months, known as chronic insomnia. Insomnia can be caused by biological factors such as anxiety, depression, sleep apnea, genetics, and chronic conditions. It can also be caused by environmental factors such as sleeping habits, the safety of the place where you sleep, and the comfort of the bedding and the room where you sleep. Corresponding to the statistics of the American Sleep Association, approximately 30% of adults experience short-term insomnia, while 10% of adults suffer chronic insomnia. In the United Kingdom, approximately 50% of adults complain of short-term insomnia, while 10 to 15% suffer from chronic insomnia. But why do we need sleep? Sleep is essential to our biological metabolism and for the proper functioning of our nervous system. For instance, insomnia can significantly affect protein metabolism necessary for the function of cells, tissue, and organs. It can also lead to cognitive disorders, example, effect on learning and memory, and mood swings. Most adults require 7 to 9 hours sleep, while teenagers need 9 hours sleep and infants typically sleep for about 16 hours. However, biological and environmental factors can alter the length and quality of sleep, leading to insomnia. What are the biological causes of insomnia? 1. Chronic disease conditions. Any chronic condition that causes pain can have dramatic effects on sleep. For instance, rheumatoid arthritis can lead to shorter sleep times and fragmented sleep, resulting in a poor sleep quality that feeds back into a heightening sensitivity to pain, creating a vicious cycle. 2. Genetic factors. Using the genome-wide association study and a genome-wide gene-based association study in 113,006 individuals, a study identified 3 loci on chromosomes and in 7 genes that are associated with insomnia. Among these, a strong association between the developmental gene MICE1 and insomnia was reported for both males and females. 3. Breathing-associated conditions. Conditions that prevent proper breathing, such as sleep apnea, asthma, congestive heart failure, and chronic obstructive pulmonary diseases, can all lead to insomnia. Breathing difficulties result in frequent wakening, shorter sleep times, and fragmented sleep, which lead to poor sleep quality. 4. Urinary conditions. Conditions, such as an enlarged prostate and urinary tract infection, result in frequent urination at night, known as nocturia, that affects sleep quality. 5. Mental health disorders. 1. Anxiety and depression. Anxiety and depression are mental states characterized by psychological symptoms such as low mood and self-esteem, irritability and intolerance to others, difficulty in making decisions, and suicidal thoughts. A study that analyzed the link between depression and insomnia in 7,954 respondents who were questioned about sleep complaints and psychiatric symptoms found that the risk of developing new major depression was much higher in those who had insomnia at both interviews compared with those without insomnia. 2. Post-traumatic stress disorder, PTSD. One of the main characteristics of PTSD is nightmares that relate to previous traumatic events. Nightmares can disrupt sleep, and their repetitive frequency can create a fear of falling asleep. 3. Chronic fatigue syndrome. Insomnia can be caused by chronic fatigue syndrome, an illness characterized by profound disabling tiredness, a diminished capacity to perform routine tasks, and sleep disruption that lasts for more than 6 months. 4. Headaches and migraines. A headache is a symptom of continuous pain in the head, face, or neck that can last from 30 minutes to several hours, while a migraine is a severe form of headache that manifests as an excruciating pain on one side of the head, accompanied by a feeling of sickness and an increased sensitivity to light and sound. Pain from headaches and migraines can significantly affect the quality of sleep. 6. Medication. Medications such as diuretics, some steroids, example prednisone, decongestants, beta blockers, asthma medications, example theophylline, can lead to short-term or long-term insomnia depending on the duration of the treatments. For instance, diuretics can increase the frequency of urination, while prednisone can cause headaches, stomach pain, and sleep disruptions. 7. Stimulants. Caffeine, nicotine, and other central nervous system stimulants increase alertness, which prevents the willingness of going to sleep. 8. Restless leg syndrome. Restless leg syndrome is the urge to move legs due to unpleasant sensations, such as tingling and aching, and that is relieved by movement. This condition can result in sleepless nights, and therefore, contributes to insomnia. 9. Dementia. The sleep hormone melatonin is essential in the synchronization of the circadian rhythms, and in ensuring the quality of sleep. In dementia individuals, melatonin secretion is low or dysregulated, which affects sleep and leads to insomnia. What are the environmental causes of insomnia? Environmental factors such as the comfort of the bedding and the room where you sleep are essential for quality sleep. For instance, if the bed is uncomfortable, or if your partner is snoring, or your surrounding is noisy, the quality of your sleep will be affected. What is the treatment for insomnia? Depending on the causes of insomnia, treatment can include lifestyle changes that promote quality of sleep or cognitive behavioral therapy. Lifestyle changes can involve improving the quality of the bedding, the room where you sleep, consuming less coffee and nicotine-associated products, and exercising. Cognitive behavioral therapy can help improve sleep patterns through the introduction of changes in behaviors and thoughts that interfere with sleep, such as maintaining a consistent sleep schedule. For insomnia that is caused by anxiety, depression, and chronic fatigue syndrome, cognitive behavioral therapy can help improve cognitive disorders, behaviors, and develop coping strategies that can also help with sleep. In conclusion, insomnia is a serious condition that can have severe repercussions on daily life. If untreated, insomnia can lead to mental health problems such as anxiety and depression. Although most of the causes can be prevented through changing lifestyle and environmental factors, some are associated with genetics, aging, and neurodegenerative diseases that require more advanced medical treatments. If you enjoyed the video, please like, subscribe, and share for more videos like this.